Welcome to the Simulation Debriefing PowerPoint. This PowerPoint is going to be used in the School of Nursing to train faculty, graduate assistants, and teaching assistants who will be participating in debriefing simulation scenarios. It is essentially one long PowerPoint that has been broken into 4 parts, essentially for the making it easier to download and to move from place to place. The resource list for all of the 4 PowerPoints can be found at the end of the 4th part. This is part 1, which includes background, definitions, importance, the 3-step model, and the Anaxel Debriefing Standard. On most of the slides, there's a little speaker icon that you can click on to hear the audio that has been recorded, or you can pause it and just read what is on the slide. You can proceed to the next slide now. This debriefing initiative came about because of a couple of different reasons. First of all, we recognize that a lot of the learning that happens in simulation happens in the debrief. And the literature has demonstrated this, and if you have conducted simulation and debriefing, you know that this is true. So that means that debriefing is very, very important. If we have decided that debriefing is very important, then it needs to have a training associated with it so that we know that everyone has at least all of the same information. We also want to evaluate competency in this strategy if we are saying that it is very important. And so that's why we have integrated also the use of the dash tool. This training will introduce the dash tool, and it will also introduce a lot of the literature that demonstrates the importance of debriefing, some of the different types, and some debriefing basics, some tips from the experts, and that sort of thing. The other reason that we have started this debriefing initiative is because of the Anaxel standards, and that the Anaxel Debriefing Standard is also reflected on in this PowerPoint. We don't become master debriefers by taking one training or one class or even having conducted debriefing before. Debriefing, I want you to think about it as a skill. It's a teaching strategy embedded within another teaching strategy that is simulation. It's something that we improve over time. There's an art to it, and it happens through transformation. There are many definitions of debriefing in the literature, and there are some variations in how they define debriefing, but pretty much what we define as debriefing is a guided reflection where the student is self-reflecting, self-assessing, and then discussing and processing what they have learned. So for us as faculty, what that means is that we must resist the temptation to lecture. Your role is to guide the students toward self-reflection and self-assessment. And I'm going to give you some tools throughout this training to help you do that. But the big takeaway here is that it's not another time to lecture. We need to resist the temptation to do that. This is another definition of debriefing from the literature that defines debriefing as a teaching strategy, that it is in and of itself a teaching strategy, which means for us that we improve in it over time. The takeaway for this slide is that students do have a strong need for debriefing immediately following the conclusion of the simulation. If you do not debrief immediately after the scenario, they will debrief on their own. So if you have a long scenario, say, or it goes a little long, and you say, well, to the students, well, why don't you just go to lunch? We'll debrief when you get back. Guess what? They're going to debrief at lunch. And now you just missed a vital learning opportunity. The other piece of this is that clinical skills are not fully mastered without feedback and reflection on the cognitive, affective, and psychomotor domains of the learning experience. So in debriefing, you should be reflecting on all three of those domains, cognitive being the knowledge that they have about it, affective being the attitude or the self that they, apply to that scenario, and the psychomotor being the actual skill that they perform. The reaction phase is basically like it sounds. It's where the students initially react to the scenario. And this starts immediately when the scenario is done. So they start debriefing and they will react on the way to the debriefing room. So the way to handle this is just to say, okay, everybody hold your thoughts. We're going to debriefing, and direct them down the hall to the debriefing room. They will start rapid fire questions of the faculty. Why did this happen? Why did he react this way? Why did it happen this way and not this other way? I don't understand this. I don't understand that. Resist the temptation to answer those questions. Allow them to ask the questions and then open it up to the group. Say, okay, let's open this up. Why do you think that might have happened? What do you guys think? What does the group think? And try to allow them to come up with that. You want to reinforce safety there, so reinforce the idea that this is a confidential experience, that what we share in debriefing is going to stay in debriefing. You can reestablish the fiction contract, we call it, and where, the faculty say, okay, yes, we recognize that there are some limitations in simulation, there's limitations in technology. We are doing our best to make sure that the simulations are as real as possible, and the students also have to make that commitment. If they start in the reaction phase complaining about the technology, and they sometimes will, well, I would have done better, but I couldn't make the Pyxis work, or I couldn't hear the patient because the audio was so bad. And that does happen. You can bring it back to a real situation and say, okay, what if you couldn't understand your patient? Are you always able to understand your patient? Sometimes you can't. What can you do if you're not able to understand your patient? Who can you call if you're having a hard time getting into the Pyxis unit or into the, getting the IV pump to work? How would you troubleshoot that if it happened in a real situation? And just bring it back to something real. This is also where you review the objectives. And on every single debriefing log, we've always had debriefing logs that had a series of questions that you could use to try to stimulate that reflective thinking for students. And we still have those debriefing logs, obviously, but now what we have are the debriefing guides. They are oriented to each phase. So it'll say, in the reaction phase, here are some really good questions that you can ask. In the understanding phase, here's some questions you can ask. And here in the summary phase. Also on the debriefing guide will be a list of the objectives for the scenario. So when you start the scenario in the reaction phase, you should say, the objectives of the scenario were this, and just read them. This is what we expected to get out of this scenario. And then that establishes that this discussion that we're going to have is oriented to these objectives. The understanding phase is really the heart of the debriefing process, and this is where the bulk of your time should be spent. This is also where you would pull up maybe some pieces of the video. If you saw in the video, the recording, that maybe there were some parts of communication that you thought were really good, you could pull those up on the video and say, this is what I saw, this is what I observed. Or, if you see something like a performance gap or a knowledge gap, you can say, I'm curious about why you chose not to increase the patient's oxygen at this point when they were hypoxic. So it's an advocacy inquiry-based technique where you're first saying, I saw, I observed, I think, and then you're saying, I'm curious about why you did this, or I'm wondering why. I want to discuss these three things, A, B, and C. The summary phase is, of course, very important because this is the part of the debriefing where the students think about, how am I going to apply this to a real situation? And I think an effective technique for doing this, make sure that you save plenty of time for the summary phase. Sometimes we run out of time, and this is the part that gets kind of cut short. But make sure that you save enough time for the summary phase, because what I like to do is to go through the circle, and every single student has to commit to something. You know, what is one thing that you have learned from this that you can use in the future? You know, how are you going to apply this to a real situation? What would you do differently if you had the opportunity to do this again? You know, what is your big takeaway from today? You know, whatever question it is that you want to use, and those also will be on the debriefing guide. But I would suggest getting every student to commit to something. This is also part of the commitment that they make in simulation, and you can establish this even way back in the reaction phase, is that I expect every person in this room to commit to contribute. You know, sometimes we'll have a group of 6 students, and you'll hear from the 3 of the 6, and they'll dominate the debrief, and then you have 3 that sit silent and never say a word. So establish right at the beginning, I expect a contribution from each of you. I don't normally put this many words on a PowerPoint slide, but I wanted you to have the debriefing standard from ANACSL in its entirety. ANACSL is the International Association for Simulated Clinical Learning, and it is an association that has established standards of practice for simulation. Standard number 6 is the debriefing standard, and part of why we are doing this training is to incorporate the use of the ANACSL standard. When you read through this, and it goes for several slides, so I won't have a recording on every slide. You can just review this slide on your the standard on your own. But when you go through this, you will see that there are several pieces in the debriefing standard that we are incorporating into this training, like, you know, evaluating debriefing with a standardized instrument, and making sure that debriefers are trained, and, you know, even simple things that you would think are obvious, like if you were going to debrief a scenario, you have to have watched the scenario. It just basically defines debriefing for us and says this is the standard of debriefing now in the industry.